Okay. So thank you, thank you. I would just want to bring you to this point where now the caregiver, eh, the child has been identified in the. Let me just take you back a little bit. Has been identified to have a spinal disability or related condition, and now this child, the mother does not know where to start in terms of which hospital to go to. And in this case, I'm looking at those in the rural setup and those in the urban. So in the rural setup, where does this caregiver, and I'm using the mother here because more often than not, it's the mothers who
take
really,
the care
yeah.
of the baby. Yes.
Where does
No,
this
it's a good
person
question.
go to?
To my opinion, when the child is normally they choose the general practitioner as the first choice. I think in Kenya we choose clinical officers first, medical officer first. So you go to the urban medical center and get it correctly checked by the clinical officer or medical officer. They are also equivalent to justify this the seen deformity. If it is not justifiable, means if it is not visible deformity, then it might take some time to identify it, because then we have to await till the symptoms comes, and then you will be referred to the specialist, and then they find out something else. But mostly the first option is the same, you go to clinical officer and medical officer, get it checked, and thoroughly if they check, they can easily find out, because in spina bifida and other things, patient normally, if the patient doesn't have symptoms, it's okay. If the patient is having symptoms, you will know, because the patient itself, mother will be telling that she is not controlling this, she is not knowing now, after 2 years and 3 years, she is still not knowing the susu is passing, she is still not knowing the stool is passing. So certain things, as she is now not speaking at all, she is not walking at all. So those are the things will justify you that there is some associated issues that we have to justify and find out.
Okay.
So we get so many kind of early detection also, because mother is the one who detects many things at home. And like CDH, congenital dislocation of the hip, developmental dysplasia of the hip, we get many conditions which is detected by the mother itself. They come that both the leg doesn't look equal. So those are the first person who can decide more than us also. To me as a doctor, I believe that mother can detect certain things which you cannot detect, because mother see the person is walking with the limping, but when it comes to your office, he might never walk in front of you, so you will not justify that.
That's true.
Yeah.
That is true. So the first place you go to the clinician or to
Yeah.
the nearest doctor near you.
Yeah, at least to justify the identifiable visible deformity.
Okay.
It's very easy. Suppose if you put the kid here and if you find that one leg is short, it is identifiable. So like that I'm talking about. Suppose if there is some hole in the skin, you will identify. So whatever is visible and identifiable deformity, that can be easily identified by the clinician. Even you don't need specialist for that immediately. For the treatment and correction, you might need specialist.
Okay, now like that's actually where we are going now. So now, what do you expect when we come in as a caregiver, the treatment that the child will undergo?
That's what I'm telling, that it depends on the condition which he is suffering. And all the conditions not require surgery. Like I have told you that spina bifida, if the patient doesn't have the symptoms, then there is no need of any surgeries, right?
Yes.
Early onset infantile scoliosis, patient is having a bent spine, that also we will give time. Club foot also we will do some sort of a conservative treatment for the mother for some period. So gradually it ends up into the correction. If not, then surgical correction comes. So most of these surgeries are being done. If it is a congenital deformity like spina bifida you're talking, and it is creating other issue like hydrocephalus, then normally people do immediate surgery. Like 1 year, 2 year, they do the surgery. Certain cases like scoliosis and other things, we wait, we give some time, and we do surgery at 4 or 5 years when the kid is little bit grown, and if the deformity is still persisting or increasing, then we do that.
So there is no, is there a window, a time frame where you say this is the best time to actually do do the treatment for better results?
Yeah, there is a window, but it depends on each and every conditions.
Okay.
That window is different for each conditions.
Okay.
Right, like knock-knee deformity. So this is the time to do surgery. The same way, everything like club foot, yes, conservative trial, give conservative trial, successive. If you are giving 1 or 2 conservative trial, it's not correcting, then go for surgery.
Okay.
The same way it comes to the scoliosis. You first start with the brace therapy, you start with the medical therapy, and then if it is not correcting within 3 to 4 years and increasing, then you take a call.
Okay.
So every condition has a different indication for the surgery.
Okay. So for
So it is like a learning orthopedics. So it's better that we cannot predict. But yes, if you choose a correct doctor, then things will be treated very easily. From my point of view as being a mother is to identify the problem first,
yes.
to reach to the correct doctor. Those two things are the step from the mother. Then if it is a correct doctor, then he will, according to his clinical knowledge, he will guide you better.
I love that, the correct doctor, because that's where it's actually dark for many mothers.
The correct doctor is like this. See, this world is like this. If you go to clinician, and clinician knows that this is a clubfoot deformity which cannot be treated by me, so he will tell you go to orthopedic. That is correct doctor.
Okay.
So once you go to the orthopedic will guide you. Suppose if he is not able to correct the issue, then he might guide you to the further specialist. So that's how, not here, any in the world, this is the cycle.
Okay.
And that's how people end up getting to the good specialist. If you expect that the mother will directly go to the spine surgeon or mother will directly go to the consultant, it's very, very difficult for her also to decide. So this channel is correct channel. Only the good thing is that you should get a good clinician first.
Yes. Yeah. I think that one we cannot emphasize it enough. Getting, your point of entry, make sure preferably maybe a level 4, level 5 hospital in Kenya.
Yes, level 5, level 6 is better.
Okay. So even for the caregivers to know, that's the the place where you can get a good entry point.
And also there are, what I have identified is not here in the world, because I do practice in 12 countries. I go here, do clinic in Tanzania, Rwanda, Uganda, Zambia, Zimbabwe, Congo, Malawi, Oman, Dubai. So I have a peripheral centers where I do clinic and patient choose me and they sometimes come for the surgery to Kenya also. So that's how we increase medical tourism in Kenya. So what I have identified, which is common, is mostly the kids are not being checked. Like they never do the blood grouping, never do the blood test, they never do. So early screening can also help you for the diagnosis. Okay. Suppose if you opt that option of early screening, like the kid is born, after the birth immediately, if you do like the general checkup like blood group, some hemoglobin and your body check like kidney profile, liver profile. So if this normal body scan like ultrasound of the abdomen to check how are the organs like undescended testes are there or not, all those things. And if you do the if you found some deformity and if you do the x-ray, so those early screening, you will not require a correct doctor, because that screening will justify and the doctor will definitely guide you the people. So in my opinion, if we opt that option in the curriculum, that all the children should be checked with the basic blood investigations and basic x-rays, that will be better. And other option for the adult also, I will tell that we also don't do the checkup. So mostly every yearly the full body, at least the full body workup will identify you for the early diabetic, early hypertension, for you identifying the early kidney disease, early liver disease, so you can rectify it without reaching to the later stage.
Okay. Oh, thank you for that. Actually, I know many caregivers, that piece of information is not there. Then probably at the point where we take the baby for well baby clinics, that could be a very good entry point for such a checkup. Okay. Now, as
But you know what happens in this, what my experience with the developing country is, they are overwhelmed. We cannot even blame the system,
okay,
but people are overwhelmed. Let's say, suppose today, if I am sitting here as a doctor and I have to complete 200 patients,
yes,
then quality of care is not getting. Because being a human, you cannot complete 200 patients in a day, right? So then what happens is, you will start relying on the other people like nursing, your team. That is also good, but then gradually you will start missing out the points which should be noticed by you. So that is the basic. So I think we have to work on that also, that how we can accommodate more doctors in the local rural area also, so that at least they can be equally getting equal patients and get the good treatment. So that is, I think, government projects are also in working, because according to me, the Kenyan healthcare has really increased in certain 5-10 years. That we are coming up with all these higher technology, like I have a laminar flow theaters and high end CM machine, high end anesthesia trolleys, X-rays. Even we have 3 Tesla MRI machine also, and now Aga Khan brought PET scan machine also. So Kenyan healthcare is really improving and growing.
and most of those are in the urban setup.
Yeah, most of them are urban center, but Mama, it is accessible. What I am talking here is, it is not in the country, and you have to travel out of the country.
Oh yes.
So still it is better. That's why I'm putting is
Yes.
that Kenyan health sector is improving. Because if you see the if you go to the finances calculations, let's say from the NHIF and general cash payers, around I still remember that in 2012 or 2014, around 8.6 billion shilling were going out of the country for the medical treatment.
Wow.
So now at least most of the treatments are available locally. So that's by that way we can say that the Kenyan healthcare is really growing.
Okay. True that.
Even there is a now saying that after South Africa and Egypt, the African people prefer for the medical tourism, the center is Kenya third. So gradually we are growing, maybe we might reach to first also. So that's how now, right now competition is only between South Africa, Egypt and Kenya, 3. So in healthcare sector we are really improving.
That is, I can't conquer, because I over the COVID period, there were very many flights to Kenya, just bringing patients.
That's what I'm telling. And even I also receive so many patients from Zambia, Zimbabwe, Congo, and Uganda, Rwanda for the spine surgeries and other. So at least monthly, our frequency is around 8 to 9 patients coming in the country.
Wow. Okay.
So yes, it is improving.
Okay. And now that we're actually on that, let's talk about the costs before we go to
No,
what
our
mother
cost is
can
very
do.
much favorable because we have NHIF cover. So for the local patients, yes, all the surgery is covering. But because we are using high-end technologies and advanced technology, little bit cost is there. So patient has to also co-pay some amount, but you are getting a good services like endoscopic spine surgery. We are the pioneers.
Okay.
Minimal invasive spine surgery. So all those surgeries are done under local anesthesia, where there is no any cut, no any stitch. You are awake during the procedure. After the procedure, immediately you walk out of the theater on your feet. So all those things are accessible from your own house, because initially people has to fly to India, Germany, South Korea, so many places, and now it is available in the country. It means you are saving money by anyhow.
Yes.
So the cost is very much favorable. Normally, the surgical cost for this kind of advanced spine surgery is varying between $4,000 to $7,000. So, which is not bad, because if you opt that option initially to Germany, it might reach to $20,000-$25,000. So, I think its cost is very much favorable to the people.
Wow. Yeah, but for many Kenyans, still
No, NHIF.
maybe NHIF.
See, what happens is NHIF normally gives you 50 to 60% amount.
Oh, okay.
So, and the good thing is that you are getting a highly advanced care.
Yes. Yes.
So which you have to go to other country, but now you're getting locally. So cost is not so much implicable because NHIF helps you with some amount, and some amount you can adjust yourself, but you are getting the high class international care.
So it's important for caregivers to actually enroll for NHIF.
It's very important, by the way. At least NHIF is good. Any insurance. See, insurance is a part of life. So right now you will think that what is the need? But in my opinion, if you pay to the insurance, let's say if you are paying around 20, 30 years without utilizing it, but at least one day when you utilize, all your payment of 30 years will be taken care of, because you will get the return of all amount. So to me, it's good for the well-being, because right now in this fast life, you are driving too much, you are sitting too much, you are doing so many activities which ends up into the degeneration and other issues. So very important.
Okay. Which insurance companies, for instance, in Kenya, have you found that they have been catering? Just an example, one or two, so that a caregiver.
There are so many insurance companies who is catering all kind of surgeries.
Okay.
Like Jubilee is there, Resolution is there, First Assurance is there, CIC is there, even Cigna is there, Bupa is there, Van Breda is there.
Okay.
So the Athena is there. There are so many. You are blessed with the insurance.
Okay. So maybe just to point out Resolution, they have it's not operational anymore for now.
No, I'm just telling.
Yes,
Right
yes.
now, I'm not aware about the current situation about Resolution.
Yes.
But I'm just telling you that most of the insurance
They
used
cater.
they used to cater. I have all the insurance almost.
Okay.
And sometimes it happens that being a speciality, insurance approaches you and do tie up with you. So this is a good thing.
So for caregivers out there, it's important to know there is help. It's good to look out for an insurance cover, because it will
It is
help
like
you.
in the life, you put some portion of saving into your insurance. That's all. So while eating, you can consider that every month 1% will go to the insurance. So yearly it will be 12%, and which will be reaching to the insured amount. Because in this country, I travel the world, so insurance is much cheaper than the other countries. So we should opt that option.
Okay. In Kenya?
In Kenya, the local insurances are much cheaper. International insurance, yes, they are costlier, but local insurance. And the good thing about this is, if this local insurance you are taking at the young age, the premium will not go high. But when they detect your diabetes, blood pressure, kidney issue, and diabetes, and then you take it, then the premium will go high. So you have to be very careful from the beginning.
Yeah, you increase the risk. Yeah. Okay. So now we know that Kenya today, there are those people who might say, I have an insurance card, yes, or I'm covered by NHIF, but $7,000 equating to about 700,000 Kenya shillings may be out of reach.
No, that is the higher side you are talking about, but you are not understanding that the deformity which you are talking, let's say scoliosis and kyphosis deformity, if you go to the other country, the cost is 4.2 million shillings. Wow. Okay. So in this country, if it is done at 1.5 or 2 million shillings, still you are saving 2 million shillings. So I am putting in that way that it is affordable. I am not telling that it is affordable to each and every family, but what I am telling is a generalized way. Yes. That how it is becoming affordable. Like Uber. Let's say Uber is affordable for each and every family. But if you ask, some family will think that we cannot spend 200 shilling, right? So it's nothing like that. You have to just take as a benefit that at least that service is available there.
Yes. You know, it's bringing me to my next question. If for sure a family is not able to get 700,000, are there foundations that help? You know, that there are foundations that help cater. Do you know of any?
Some NGOs which normally works this kind of deform conditions. So I'm not sure about the specific, but I think I remember that before 2 years, during the 2020 or 2021, I got one or two cases of scoliosis which has been previously paid by some organizations.
Okay.
And then we did the surgery for. So that is another good thing about Kenya. And many of my patients also do the Harambes to cater the money, and if they have a correct letter. So the good thing here is in the church service, people normally support those. So to me, it is not 100% difficult. Yeah.
Yes.
At least it is possible.
Yes, it's possible. Yeah, and those are some of the ways that it can be possible. What Dr. is saying, to just come, because I know many caregivers, when we reach out, this is one area they keep saying cost, cost, cost. So, Dr. now, as we are winding up, have you come across support groups for caregivers who have children, even if they are not so many, but who have children with spinal conditions?
Yeah, I haven't come across the exact name of the support group, but what I have seen is like the way you are doing is people normally. I have been interviewed by Citizen and other people initially to develop one direct story of scoliosis of mama who has scheduled for the surgery in some of the hospital in India with 4 million shilling, and I agreed to do the surgery here with some small cost, and they really got. We also got so many questions, and we got the good help.
Okay.
And so people are there. Only we have to justify that, how to identify them. So you have to also come out. You cannot just feel like that. I don't want to share with the world. I don't want to do that. Once you come out, you get the help.
True.
It's possible. And also we are thinking that now next time when I get any kind of foundation who is directly helping, I will definitely take their contacts and provide you.
We'll appreciate.
Yeah, sure.
We'll appreciate. Now, our final question for the day, Daktari. Now, as a caregiver at home, you have this child. The child has a spinal condition, and as a caregiver, you live with this child day in, day out. Are there some tips that, as a caregiver, you can actually, you can use so that the child's life is comfortable in the house?
To me, I think you should become more motivated and encouraged rather than thinking that this is a burden to us. First thing is that very important. So, and there are so many Kenyans, I really appreciate that they really take it a positive manner and they help. So if you really take in that sense, being positive and arrange the areas, if you make him more positive environment, maybe the conditions cannot be corrected 100%, but at least people start living with it in a correct manner. So if you know that the kid is not able to walk, let's say, then just motivate that he should use some support like parallel bars, he should use some wheelchair support, he should start doing some work with can be done with the hands. You can also promote some housework, what he can do. You can promote the services of schooling in at house, like nowadays online school is also there. Nowadays it happens that you assign some of these kind of kids together, and one teacher you appoint and then provide the thing. So if you motivate the kid, then chances are much higher that they can come up with the good ideas and growth. So rather than, what I'm telling is, don't make them pampered and don't make them feel that they are weak. That's what is my meaning is.
Wow.
You give them the way that you are not weak. You are something. You have something which many people doesn't have. Like you have hands, other people do not have hands. You have legs, other people do not have legs. Maybe you can tell that you can see the world. People doesn't have eyes.
True.
So if you put in that positive manner, maybe the kid can grow faster and achieve some more abilities. Because everyone born with different abilities. You never know.
Yes.
Sometimes you found that the boy is not able to walk, but he become a nice painter and he can achieve the name in the world also. So to me is just motivate and motivate the progress and growth. Yeah.
Thank you. Thank you very much, Daktari. Maybe you have some closing final remarks as we are about to come to an end.
I think after this much good conversation between both of us, and she has also really tried her best that all the lemon mothers and other people can understand that what we are talking about. And I know I might not be 100% correct, but yes, at least I have tried my best with my clinical knowledge that you should understand that what is important. And I have tried my best to open your eyes, at least that some things which you don't just take it for granted that this is our mistake or this and that. And the good thing is that just accept the reality, motivate the kid, and give them the new life. That should be the motto of it.
Thank you very much, Daktari. We truly do appreciate your time.
Thank you so much. God bless you.
Thank you. And now we've come to the end of our interview. We believe you've been enlightened, you've been motivated. We believe that you will be more positive, as Daktari has said. Let's motivate the children. Let's accept them. Let's show them they have abilities, because every child has an ability. So from us, as always, we knit together. Keep the questions coming. Let the conversations flow. We will get in touch with you. Thank you, and God bless you.
Yeah.
Thank you, Daktari.
Thank you so much.
Appreciate.
Yeah.
Yes.
Thank you so much for giving me this opportunity.
Well, we're back from meeting Dr. Ritesh Patel, and it was a very good and fruitful discussion. Now there's some terminologies that were used that I have prepared for you a presentation to just debunk them, to let you understand what they mean. Enjoy the presentation. Hope you've enjoyed the interview we've done with Dr. Ritesh Patel. Our aim is to enlighten you, to equip you with the knowledge, you as the caregiver to make the right decision, and you could be a friend or a relative to somebody who is going through such a condition. Please share this video. We have our social media presence. You'll find us on Facebook, Gifted Gems. You'll find us on Twitter, Gifted_Gems. You'll find us on YouTube, Gifted Gems. You'll find us also on our website, www.giftedgems.org. We also have a telephone number that you can reach us for. That is 0740697373. Alternatively, 0202697373. We also have an email address, info@giftedgems.org. Do not hesitate to get in touch with us. We are in it together, and we are here to enlighten you, the caregiver, so that you can make a good, informed decision in an early intervention to save the life of your loved one. From us, God bless, and God be with you till we meet next time.